So today we're going to have a look at measuring your waist circumference. So waist circumference is a nice measure from a health outcome point of view, and we know that a 5 centimetre loss of your waist circumference has significant clinical gains, both for cholesterol, blood pressure, and your glycemic control, so your sugar control within your body. We look at trying to measure the waist circumference. There's quite a few common errors with it, but we look at what we call the inferior margin of the ribs. So we'll show that in a video now shortly. So you just want to palpate that, or just to feel that on your chest. And we look at the top of the iliac crest. When we look at measuring the waist circumference, we look at a mid-level between the 2 points that we've outlined there. So just have a video there just to outline this for you. When we look at measuring the waist circumference, as we saw in the diagram before, you come to the bottom of the rib cage, so you feel that quite strongly there at your side, and you just measure. You come down to the top of your hip area here, so we call that the iliac crest, but you're starting the measurement from there. So we're going to go halfway between the two, so just to pop your finger there, and then just to grab your measuring tape, and we're going to spin that around. We're just going to take a nice measurement. Obviously, you'll have your clothes off for this, so might give you might lose half a centimetre on it, and then you'll just get your measurement here. So I suppose quite a couple of errors just to let you know. So a lot of people will look at the waist circumference and consider it just around the belly button area. So just to make sure that you're not measuring specifically around that, or you're not avoiding it, and that will give you an inaccurate reading. So thanks very much for your consideration. So when we look at the normal measures, these are the target levels for both males and females, so men and women. So we look at really a measurement of 37 inches would be the target for men, and for 31.5 inches for women. So just to bear that in mind, and then we look at the high and the very high measures here. You'll see those quite clearly here on the diagram. So do consider having a look at that. It's a nice, easy measure for you to look at. And certainly sometimes while weight loss might not be coming up on the scales for you, you might be losing significant measures around that area, which has significant benefits for your heart health. And just to remind you that a 5 centimetre reduction in waist circumference is associated with significant improvements in blood pressure, your cholesterol or your lipids, and your glycemic control. So thank you very much for your attention.